moving on to the extremities. So in all mammals, we have the same orientation. Starting at proximally, we have one bone, two bones, many bones. One bone, two bones, many bones. And we're going to start with the bone of the upper arm, the upper extremity, called the humerus. And here's a humerus. So the humerus is pretty easy. We're going to start here proximally with the head of the humerus, this rounded bit that fits into the glenoid cavity that we just talked about in the scapula. So we have the head, and behind the head we have this little constriction. This is the anatomical neck. And then we have these two bumps, the greater tubercle, which is superior and more lateral. And then if we move to more medial and inferior, we have the lesser tubercle. In between those, we have a little ditch called the intertubercular sulcus. Sulcus meaning a ditch, and intertubercular meaning a ditch between the tubercles. So that's easy. And then underneath that, we have a little narrow area called the surgical neck. So we have the anatomical neck behind the head and a surgical neck here where it gets skinny, as if you were to break that off. That would be the surgical neck. And then we have the main body or shaft of the humerus. About a third of the way down the anterior portion of the humerus, you can feel a roughened up area, and that would be the deltoid tuberosity. And that's where the deltoid comes down and actually pulls up the arm. And anytime a muscle is pulling on a bone, you get a roughened up area, because bone is very much a living organism, or not an organism, but a living tissue, and so it continually remodels.